This presentation is a theoretical project created for educational purposes. The information shared is based on research and course materials and does not involve direct interaction with the homeless community. Our goal is to raise awareness and propose strategies to address homelessness in Canada from a community health nursing perspective. Hi, my name is Jasmine and I'm the nurse leader.
Hello, my name is Hardik Sharma and I am Community Outreach Coordinator.
Hi, my name is Manendra Singh and I am Social Services Advocate.
We are here for our community assessment on homelessness in Canada. Let's dive right in and discuss the key points.
Well, homelessness is a pressing issue in Canada. Over 235,000 people experiencing homelessness each year. They are a vulnerable population, and this community really needs our attention.
Exactly, and focusing on this group aligns with the goals of community health nursing, which is all about advocating for those who are marginalized and ensuring that they have access to the healthcare and resources they need.
Right, we are aiming to highlight the struggles they face and identify the ways to improve their access to health services and social support. Uh, the homeless community in Canada consists of individuals who don't have stable and permanent housing. This includes people living on the streets, in shelters, or in the temporary accommodation.
We will focus on larger urban centers like Toronto and Vancouver, where homelessness is more visible. Through this is an issue across the entire country.
Yes, exactly. Despite coming from different backgrounds, homeless share similar challenges such as access to affordable housing, healthcare, and social stigma.
Get a true understanding of these needs, we are planning to do needs assessment. This involves surveys and interviews to gather quantitative and qualitative data.
We'll also do a windshield survey. This allows us to observe the conditions in area with high homelessness rates and a sense of the living conditions.
And I think it's important that we also involve interviews with the people who provide services to the homeless and like shelter managers and health workers.
Let's talk about rationale. So our goal is to identify the gaps in services and to figure out how we can address them. And these methods will give us both numbers and real life stories.
We will be gathering information from various sources like government reports, research papers, and organizations that work directly with the homeless, such as shelters and health agencies.
By using these reliable resources, we ensure that our data are accurate and up to date, which is crucial for effective decision making. Getting into the strengths and challenges of the homeless community, while this population faces a significant lack of affordable housing, mental issues, and exposure to unsafe conditions, there are also the strengths.
Many homeless individuals are resilient and there are community organizations that helps them. The organizations offer essential services like food, shelter, and healthcare.
Yes, we can enhance these strengths by improving support system like mental health trainings and house initiatives. That's how we build capacity.
In any community assessment, it is important to identify who is the stakeholders and gatekeepers are. Our stakeholders would include the local governments, healthcare providers, social services, and non-profit organizations.
Yes, gatekeepers are people who can either help and hinders our efforts. In this case, shelters managers, local policymakers, and even people who work in public health would be the key gatekeepers.
We'll engage with these stakeholders through regular meetings, public forums, and collaborative partnership to ensure that all voices are heard and we have their support.
So now we are going to talk about ethical and advocacy consideration. So when working with the vulnerable populations like the homeless, we must adhere to ethical principles. We need to respect their privacy, ensure their dignity, and avoid causing harm.
Advocacy is also important. We need to push for policy changes to ensure that there is more funding for affordable housing and better access to healthcare and mental health services.
And we must make sure we approach everything with the cultural sensitivity. We don't want to exclude anyone from the process, and we need to advocate for those whose voices are often unheard. Throughout this process, we have learned a lot. We now understand how vital it is to approach the community assessments with empathy and a collaborative mindset.
We have also seen how essential it is to combine both qualitative and quantitative data to get a comprehensive understanding of the community's need.
Yes, working on this assessment has deepened our understanding of the social determinants of health and the role of healthcare workers in advocating for vulnerable groups.
Thank you. We hope you now have a better understanding of the homeless community in Canada and our approach of assessing their needs.
By focusing on these issues, we hope to help create better support system for the homeless people.
If you have any questions, feel free to ask. We look forward to your feedback and hope that our findings can contribute to meaningful change. Thank you very much.
Thank
Thank
you.
you.